Thanks, Dr. Karthik, for covering that time period. So now we have my slides ready. So as I told, we are going to talk about another important product by Nipro. So this is about a dialyzer which is called as Elisio HX. Why is it different and why is it beneficial? This is what I am going to talk on. We all know that Nipro is a well-established dialysis-related company, and there are already these products available in India. And this is one of their new products for India, not for Japan, because in Japan it's been in use for more than 10 years already, and they have the data regarding the use of this also. But in India and most of the other parts of the world, it's a new dialyzer. So let us understand how this is better. So coming to the Japanese dialysis outcome. This Japanese dialysis outcome, we can see here that survival among HD patients in Japan as compared to Europe and United States, we are not even talking about India. Here we can see that the survival rate of dialysis patients in Japan after years, that is 20 years, is more than 90%. This is not 1 year, that is 10, 20 and 30. And it is much better as compared to the US and Europe data. This is how it is better, so much better survival in Japan as compared to Europe and US. But why is it better? They have some postulates and some data. And it is seen here that the percentage of AVF or AV graft use is very high in Japan as compared to catheter use. And patients usually stick to the schedule of dialysis. They usually get the dialysis done at regular time. We all know that the Japanese people are very punctual and they are very time honoring people, and they stick to it. Even the patients or the doctors, they stick to the time. They give the patients the full set of dialysis. This is what can be the contributor factors. But apart from that, there are other factors. Let us look at that. This is the data which is available, which shows that in Japan, most of the patients are using AV fistula or AV graft. Catheter use is almost negligible. And what are the other factors? That is the dialyzer. What is the difference in the dialyzer between US, EU and Japan? We all know that we classify dialyzers as low flux, mid flux and high flux. And if at all we look at the beta-2 microglobulin clearance, when it comes to the small molecules, the clearance is good with whatever dialyzer you use. But when it comes to the mid molecules, which is the most important molecule, what we consider or measure is the beta-2 microglobulin. Even with the high flux, the removal is about 40 to 60 ml per minute. But the Japanese classification of dialyzer is according to 5 classes, 1, 2, 3, 4, 5. In the 4th class and 5th class, which they maximum use, it is more than 50 to 70 in 4th and more than 70 ml per minute clearance in 5th. This shows that the millimolecular clearance is much high in the dialyzers that are used in Japan as compared to those that are used in the rest of the world. And 93.8, almost 94%, that is almost all. So dialyzers what are used in Japan are category 4 and 5. This might be one of the reasons for the better survival benefits that are seen in the Japanese population. Coming to the Indian scenario, we here have found that this is according to the market availability, whatever is sold in the market. According to it is seen that 95% of the dialysis happen with low or medium flux dialyzers, and high flux is used only in 2 to 5%, and hemodiafiltration is still less. And even with all these things, we see our patients surviving for a longer time, and more chronic dialysis related problems are emerging in the due course. This is the Indian scenario at present, and we all know that serum beta-2 microglobulin is related to the mortality rate. Let us not spend much time with that. And because of this, the clearance of beta-2 microglobulin and other middle molecules is very important. It has been seen, apart from the beta-2 microglobulin, the life benefit is the patient survival. If it is seen that the dialyzer itself is very important, and we have data regarding that also. Here, this is the same company, Nipro dialyzers. We can here see that whatever is the high flux, if that is considered as the reference, if we take this reference as the high flux as reference as 1, with the super high flux, that is what I am talking about, that is the Elisio HX, we can see that the relative risk is much less as compared to the high flux. And with much lesser flux dialyzers, it is still very high. And we are talking of the same company, we are not even talking about other company dialyzers. So even in the same company, even with the same material, we can see that the flux matters. And now the other materials, if at all we look into the other materials, so which is the polysulfone, which is commonly used. If we take that as the reference of 1, we can see that there is a benefit of using polyether sulfone, which is used in the LCO dialyzers, and it comes to 0.9 as the hazard ratio. And with many other molecules that are available like PAN and all, it is much more than the reference, which is the polysulfone. So here we are looking at the type of membrane, the flux, and LCO-HX is something which combines this both. It is called as a super high flux, and it is with the polyether sulfone type of membrane, so that it is combining both these advantages, and maybe this is one of the factors that is contributing to the longer survival of Japanese population who are on dialysis. We need to have some data, so I will just go through, but before that, low albumin leakage. We all know that albumin is a very important predictor of morbidity and mortality in dialysis patients. And here in this, we can see that the lower the albumin level, the worse is the mortality. And with this understanding, whenever the patient undergoes a dialysis with high flux dialyzers, there is always a risk of albumin leakage. Why this happens is because the symmetry of the pores is different. Here we can see that in this slide that the pore size are very different. There are 3 different pore sizes. This is size A, size B and size C. So what happens when the dialysis is happening? In the pore A, everything can go out very easily. In the pore B size, so only the beta-2 microglobulin, that kind of material can go out, but not albumin. But in type C, nothing can go out, so it is too small. This discrepancy in the pore size is what contributing to removal of something which should be preserved, that is the albumin leakage. By making the pore size as equivalent, in as much is equivalent as possible, we are trying to remove only those that needs to be removed. This is called as the sharp cutoff technology. This is what is seen in this slide. Here I would like to just point it out here, that when we take into consideration, this is around 10,000, that is corresponding to the 11,800, that is corresponding to the beta-2 microglobulin. We are comparing LCO-H, LCO-HX, this is a high flux, this is super high flux, this is other company medium cutoff dialyzer. We can see that is medium cutoff means this is again a high flux dialyzer from a different company. We can see that beta-2 microglobulin clearance is good with other company MCO dialyzer and also with HX, whereas it is little less with H. But when it comes to around 45,000, still there is a lot of difference. 45,000 corresponds to gamma light chains. And when it comes to around the albumin, that is around 67,000 is the molecular weight, the sharp difference can be seen that there is a lot of leakage with the other MCO dialyzer, whereas it is near to 0 with our HX dialyzer. This is what can be projected in this particular slide, and this is what makes it very special. That is called as a sharp cutoff technology. We all know, again a few slides are there to show that hemodiafiltration is definitely a better option for all dialysis patients, and there are a lot of studies to prove that, and all these studies ultimately just summarize that a high volume hemodiafiltration with a post dilution method is better, but even the pre-dilution method is much better than a regular dialysis. This is what all the data shows. And coming to the challenges for use of HDF, we are still struggling to use high flux dialyzer, and if at all we have to think of HDF, there has to be a separate equipment, there has to be a different handling of machines. Some training is required. If at all there are 2 sets of machines, the possibility that the technician can cause some error is much higher, and there is a requirement of extra space because a separate water handling unit also is required, and stringent water quality is required, and of course the cost of the machine itself. So these are some of the challenges that we have to face to use HDF on a regular manner for our Indian patients. And for all these things, using a super high flux dialyzer in a regular dialysis machine can actually overcome most of these issues. We have some clinical data, one the Spanish study. Here they compared the 3 types of dialyzers. So it was Eliseo HX. The second one was Terranova, that was again Eliseo HX, and Terranova was the hemodialysis, and FX cardiacs was the hemodiafiltration. All these three were compared. What was the clearance and what was the albumin leakage? These are the parameters that were seen. And if at all we look at this particular graph, we can see that the clearance was almost similar with all the three type of dialyzers or the treatment, whether it is dialysis with high flux dialyzer or with the hemodiafiltration, the clearance was very good. But when it comes to the albumin loss, we can see that with Eliseo HX, the albumin loss was the least, even as compared to HDF. In HDF also, albumin loss was not significant, but it was still present. But with Terranova, which is a high flux dialyzer, the albumin loss is much significant. It is more than 2 grams per session, which is quite significant. And we all know, already projected there, that albumin is one of the predictors of mortality and morbidity. There is another German study. It was between Eliseo HX and Terranova. Both are on hemodialysis, and here we know what to expect already from the previous study. So here also it was seen that the clearance, but here a lot of other parameters were considered, urea, creatine, phosphate, including lambda free light chains. Here it was seen that the clearance of both the dialyzers were almost equivalent, but when it came to albumin leakage, with the Terranova dialyzer, it was much higher as compared to the HX dialyzer. So this HX dialyzer thereby gives the best kind of treatment which is comparable to HDF in a normal dialysis machine and with less albumin leakage. But what is required is a very good water quality, and Japanese water quality is much better than our regular AMI standards. In the Indian scenario, we can use our whatever dialysis water is used with whatever the pre-filter that is used in the regular dialysis machines, that is good enough to use this kind of dialyzer, and thereby we can give a HDF kind of dialysis quality with a dialyzer in our regular hemodialysis machine. So high solute removal, high removal of low molecular as well as middle molecules, and low albumin leakage. These are the special things about this particular dialyzer which I would like to highlight here. Thank you all very much for your attention and time. Thank you.